Hi, Dr. Saxena here, and today we'll be talking on something about food allergy, food sensitivities, and all. What does it mean? Yes, I'm talking about food allergies, which is a big kind of thing. 10 million Indians suffer from food allergies. This is a quite old thing, literature, what I have picked up. And having worked with some areas where when I'm not getting the answers, we started looking into what exactly this is it an Indian food allergy, why this guy is having a problem with the peanuts and all that. We started working at 15 years back, and we knew that there is something in the tomato, something in the food which can cause, but it took us a long time to understand. Yes, this is something like oxalates, and trying to work with lectins and all. And what is the correlation with the weight gain and the lectins. So it took us a long time to understand. I just want to make it very brief so that you can always understand, but at the kind of word go, whenever it's any patient who has got allergies and all that, I would like them to understand there are 5 food triggers. One thing is cereals based on wheat and corn. I want them to totally not at all look into that particular thing. Wheat and corn is absolutely should be taken out from the diet. The second thing which I'm always focusing is the dairy products. Any kind of dairy products are particularly known for any. These are the allergic food triggers which causes a big issue. The third one which I would always talk about is the nuts, and the nuts are always it makes you nutty. Fourth one is the citrus fruit, and the fifth one is the caffeine. Caffeine is also a big issue with a lot of people. So when we talk about going when you start with our protocol and all that, we tell them, okay, to stop this foods blanket ban, and slowly we rotate on a rotation diet. We try to start one by one later. So these are the things which always are in our mind. We are talking about what are the phenolics in the diet, what are the how to cut down the sources of copper from the diet. Chocolate is a big allergen, and I'm sure chocolate, I was not including that, but if you can always get idea about that. Why caffeine we have talked about is with caffeine is that it's a big excitotoxin, and it has got and something like MSG, monosodium glutamates. You have got dyes, food dyes, people using a lot of food dyes, nitrates, sulfites. You have got processed foods, particularly when we talk about something like this most of the processed foods, including the meats and all that, that has a problem with this one. And you need to be careful, because what happens is that your gut is not designed to handle this kind of, I can say, toxins only. How does it works out? What happens? And if this is how a clinical picture we try to talk about something like a leaky gut syndrome, which happens with most of the people who have got a problem. And the clinical picture looks like this. They get into something like constipation and diarrhea. They have abdominal pain and bloating, and mucus or blood in the stools. They may have something like joint pains and all that. And nasal congestion is a hallmark with all these people. And it took us I started working in autism, and it took us a long time to evaluate that. And now we see most of the people who are using something like having people with eczema, not just autism, skin rashes. You have got something like asthma, people with poor memory, mental fog, people taking a lot of this one kind of analgesics overuse and all that. And yes, inflammatory bowel disease is a big on the list. And that inflammatory bowel disease we talk about, I mean, like ulcerative colitis, you have to talk about the Crohn's disease, and we do see a lot of inflammation happening in the small intestines as well. Apart from that, I have some more thing to look into, that is called fungal problems. Where we have something like dysbiotic flora, in the sense you have got a your intestinal microbiome, what is called, has to have some good bacteria, and 90% or more than that should be good. And some cases, in some nasty bacteria and all that, okay, fine. There will be normally symbiosis is between a healthy exchange with a normal human being as well as the bacteria. Bacteria contributes, and human also gives food to the bacteria. And yes, bacteria gives you the vitamin K2, bacteria gives you the short chain fatty acids. That is a kind of kind of mutual understanding between these two things. But what happens is that instead, if you have got more bad bacteria or something like yeast or moniliasis or fungal problem, instead of that a simple good bacteria, then you get into problems, and there are huge intestinal issues come up, and you get something called inflamed gut. Because of all these things, whatever we had shown you on the back, this particular thing, this is inflamed gut is one of the diagnoses which now I try to work it out so easily. Having worked in ultrasound for some years, maybe some decade, more than 2 decades, I believe I used to get a reference of having pain abdomen is an emergency for a. I worked in a pediatric hospital also. But what happens is that as a radiologist, I used to see what are the surgical issues are there. Like we used to look at the gallbladder, any problem is there, pancreas, any problem is there, right lower quadrant, which is appendicitis and all that, we used to look into that. So this, having checked all these things, and you should have no surgical issues, but the patient is having the constant pain, and now I would definitely give that term called inflamed gut to this particular thing, because this is usually because of the inflammation which is causing something like jejunitis or ileitis. This is the basic kind of thing which is the result of some things like oxalates or some big things. And here I would like to talk you about one thing called oxalates. Number one, what are these oxalates? Oxalates maybe are basically this kind of substance, and what happens is sulfates and oxalates, they have got the same kind of thing. Oxalate, I have seen most of the problems in autism, but I do see a lot of other cases, in the sense people having that joint problems, people having that other issues, that also gets into that is also one of the tricky things which oxalate can present like that. So what these oxalates are doing is basically they are doing some kind of necrosis here, and with the resultant is the cell membrane. You have got a leaky gut. So there are what happens is that there are effectively holes are being made, and that causes a problem. So when you have got the thing called leaky gut, and here what I can always tell you is this leaky gut is we had seen a lot of cases. In the sense, most of the people, we are still trying to understand what is the gut relation with the it is with the diabetes, it is with the thyroid problems, it is there with the lupus, it is there with autism. Gut and constant, there is a correlation between these two things, and now we understand it is because of this particular thing called this oxalate, and you have got oxalates or lectins or so many other things causing that leaky gut, which gets into the thing called inflamed gut, and you get into problem. So oxalate has got the capacity to cause that cellular distress and oxidative stress, and this will deplete the glutathione, turn in the inflammatory cycles, and that is one of the reasons you probably you get into that glutathione depletion, because of this the body has to constantly fight at the gut level itself, and this results in something called leaky gut. So leaky gut is a simple stuff which you can always understand. It's because of the oxalates and all that, because it's before that oxalates trying to take up the calcium which has to be needed to seal that gut in case of a kind of leaching and all that. So the what happens is that because of the oxalates, all this calcium is being taken away by the oxalates. So this always results in a deficit there, which causes that leaky gut. And we leaky gut is very important when you understand, when you try to work on something like autism or any autoimmune diseases. You need to understand that concept of leaky gut. So because I had been on a we had seen the kind of results what we get just by fixing that gut. And apart from that, I would definitely like to talk about something more on oxalates next time. So this is particularly leaky gut, and the kind of thing which we worked very diligently in all the autoimmune diseases. What helped was the diet, and try to avoid a low oxalate diet and try to work with the lectins and all that. And I can always go on and on here. I would like to show you what are the high oxalate foods which you have to be very careful. Right from your grains, you have got lentils, you have got a lot of soya, nuts, and big things, any kind of stuff. So these are the areas which you need to be careful about. And I certainly would too like to add one more thing which I may be missing out, which is something called as lectins. Lectins are there in all this wheat, millet, and all this. We spoke about all these stuffs, and this lectin also has got the same characteristics, and it causes that inflammation in a big way. So these are the class of proteins basically that are found in common foods, and they sort of immune system. See, these lectins, get stuck to the structural carbohydrates. When they get to the structural carbohydrates of the invaders, and that makes it makes more potent, and this particular stuff, they get into some problems. And lectin damage can be cumulative and shows up as pathology years later. And I always believe we possess these surface sugars such as glucosamine, fructose, mannose, and more. Lectins can bind all these things, and it causes a damage because of this particular. They causes a direct injury to the delicate intestinal lining, and it happens at the microvilli level. It's not obvious on the what you do scopy there, that you need to be that is one of the hallmark of any autoimmune problems. You have a damage to the this particular thing. And lectins contribute to food sensitivities and may provoke immune system to make antibodies against them. That is one of the big things which is which is called autoimmune diseases. And that is what we are able to now correlate arthritis, scleroderma, fibromyalgia, thyroiditis, lupus, rheumatoid arthritis to the gut issue. And with this kind of thing, which we can always understand what are the nitty-gritties and all that, how to keep this all these lectins and all that at bay. What are the best natural shields against the lectin? You should always try to look into that. And yes, the why you can always work it out. There are things called mucins which are protect against bacteria, yeast, and food sensitivities. Mucin is the lectin binding capacity, has that lectin binding capacity. And this is not known much of therapeutically, but when we put the patients on this mucinous substances, in a case of this particular thing, you get some fabulous results. As simple as something like this okra can be such a big protective against lectins. I want all of you should understand this particular stuff. And it's a very simple thing, and it has got that the best part is that it has got the combination of proteolytic enzyme to help to clear away excess mucus formed as a result of food intolerance or food allergy. And see, and it is very beneficial for ulcers, colitis, malabsorption and all. And so this is the kind of thing. And I try to use something more called alginates also, and it gives us a good leverage against this lectin binding and all that. And see, lectin binding helps in promoting weight loss, number one, improves the metabolism and energy, it restores the water balance, achieves healthy joints, a lot of plus things. And this can be achieved by just we try to work on some things like altering the diet and trying to do some simple detox and all that, trying to work with some sulfation and all that makes us very it's a good protocol for this particular thing, how to deal with the food sensitivities. And if we are able to understand this particular thing, and we try to work out in this way, trying to deal with these pathologies. And trying to tell you that it's not just the diet and all that, but diet plays a very important role. I always believe in my practice I have this one of the diet is a major component, in the sense it has you have got, if you can imagine, three leg stool. One leg is diet, which is intestines and all. Other leg is a detoxification. Third one is the oxygen therapy. So if one also is not working, you lose the balance. And so that is with that particular stuff, I want you to understand this particular stuff in a big way. And yes, lectins and oxalates, you have to be careful. Thank you.